Hey, welcome back, everybody. Yeah, uh, it seems like the medical transition of children is still a thing that people are fighting for. And some hospitals have closed those units down, which is definitely a good thing. I believe. Yeah. Um, Medical transition of children. Is there a dark side? Okay. Um, yeah, we're going to go over medically transitioning children. Usually starts with puberty blockers, like Lupron. Okay. Doctors tend to say that it's reversible, and I've been doing some looking up on this, and that isn't necessarily the truth. Um, because there are long term permanent side effects. Okay, let's see here. God, let's see here. We're gonna get to bring this up here real quick here. 10 potentially serious side effects. Okay, from Lupron. Let's see. One, hot flashes or sweating. Hmm. Two, headaches and general pain. Three, injection site reaction. That's a typical thing for any shots that you get. Okay. Now, vaginal irritation. Okay. Now, what they don't tell you is that you can get vaginal atrophy from this. Mood changes, light to severe. People want to say that it stabilizes depression and stuff when it actually does not. It makes it chronically worse. Okay, urinary and genital problems. No, we went over the female problem, genital problems that could happen. Male, erectile dysfunction, difficulty urinating, urinary tract infection, decreased size in testicles and length of penis. Gastrointestinal problems. Hmm. Sounds fun and exciting, doesn't it? Initial worsening of symptoms that can continue and get worse. Oh, number nine. This should have been more towards the top. Heart problems. Hmm. Heart racing, heart stopping. And yes, bone problems. Okay, now there's some that they didn't put on there that were probably just as important. Okay, there's another thing too that these Lupron is used for. It's used for sex offenders, convicted sex offenders. Okay, it severely reduces and destroys sex drive and the imagination of it. Okay, and decreased paraphilic ideas. And these sick SOBs want to use this on children. This is some of the stuff they don't tell parents. Okay. Buck Angel does a has a YouTube out where he ended up getting vaginal atrophy, but it wasn't from Lupron. Didn't find out from him what it does. It almost killed him. Okay, vaginal atrophy leads to sepsis, peritonitis, gangrene, possibility, all that other stuff. chronic to severe yeast infections in girls and women, males shrinking of testicles, shortening of penis, and when bottom surgery is performed after that, there's not enough. There is not enough stuff to use to make the neo vagina because the penis does not grow. Okay, another thing with these headaches causes brain swelling, mental fog, mental fatigue, decreased learning ability, long-term to permanent. Okay, now also with the brain swelling, can cause vision problems, blurred vision to permanent blindness. Okay, now by law, every prescription medication that is out there has to have side effects published and known about. That's the law. They can't keep it from you. Doctors can't keep it from you. If they are, they're committing a crime. Okay. Now, I'm wondering, why is it doctors and therapists, not all doctors, seem to think minor children can make this type of adult decision when they cannot make others? Why? Okay, well, let's see here. Therapist is going to continue to make money on therapy. Doctor is going to continue to make money treating the patient with Lupron, puberty blockers, and cross-sex hormones, which leads into pharmaceuticals. They make billions. They make hundreds of millions of dollars on just one person. And you think they want you to know the bad side effects that could cause serious damage to the body? Wow, are you serious? Man, come on. It's like, it's time for people to see some of the truth and what it's doing to children. Harm it causes children. And then another thing that they don't tell you is that when children go through their natal born puberty, most of them grow out of the desire to want to transition. Definitely over 85%. Okay? And then when they become adults, they can make that adult decision as an adult. I believe at the age of 18, because that's what legal consent is in the United States, to where they can make an informed adult decision on whether they want to do something that's extreme or not. Because it is extreme. There's, after a certain amount of time on this, usually less than a year to 6 months to a year, probably closer to a year, there's no going back. The effects from this stuff, especially on the cross-sex hormones, there's no going back. There's no going back to the way it used to be. Me, I'm transsexual. If I decided to not detransition it, I'm not going to be able to go back to the way I originally looked. It's not going to happen. And then And therapists and doctors will tell you the minor child, that they can change their sex. Well, no, that is a lie. You cannot change your sex. You can change your appearance of sex. That's all that can change, along with the change in primary hormone, either estrogen or testosterone, depending on which direction you go, male to female or female to male. That's what changes, along with the effects that those cross sex hormones bring about. They don't tell people there's permanent side effects that are irreversible. Irreversible. And did you know it's illegal to give a binder to a female that's under the age of 18? It is illegal. I don't know. Here's how people think that this is okay, doing this to children, when they don't have the ability to make other adult decisions. Except for this one. It's a radical, radical change. Radical, irreversible change. The brain rot is just through the roof. The abuse, neglect. And I'm hoping that someday it will be a federal felony to medically transition children. Because children getting medically transitioned should be a crime because it is child abuse. And being Lupron is used for sex offenders. What are you trying to say? Your child's a sex offender? It's time to wake up, people. For those of you who are against it, thank you. For those of you who are for it, you need to be locked up in a rubber room for the rest of your life. Because it's outright child abuse, and you know it, especially doctors and therapists. You know it's child abuse. Anyway, I hope these people wake up. Smell the crap they're shoveling. Because usually children will not think of suicide unless it's talked about in front of them. And how in the hell do you think this is anywhere near right for the people who are saying this? You want a dead son or daughter, or a living son or daughter? It's just sickening. It's vile. It's demonic, satanic, and pure evil. Anyway, it's a message I wanted to get out. People need to know about it. Please pass this on. And seriously, this message needs to get out to as many people as possible. So people know this is what happens. when children get medically transitioned, and they don't have the adult ability to make that kind of decision. Anyway, have a great rest of your day. Until next time, bye for now.